All right, so moving on to the right upper quadrant. So to obtain our view in the right upper quadrant, you want to place your probe marker in the anterior or mid-axillary line at about like the 7th or 8th intercostal space, and with the probe marker facing towards the patient's head. And that's a good place to start. And then you can just adjust your probe as needed to obtain this view where you can see liver, kidney, and then the diaphragm. The arrow in the picture on the left is pointing towards the diaphragm there. So that's the sort of the canonical view you want to obtain. And here's an example of someone, this is a 35-year-old male alcoholic, and he was having this abdominal pain for 3 to 4 days. When someone took a look in the right upper quadrant with their ultrasound probe, they saw this fluid collected between the liver and the right kidney. So this is ascites in this case. And fluid likes to collect in this place, especially in a patient who's been laying supine for a little bit, because that's the most dependent part of the peritoneum. Another thing you can assess is the texture, the echo texture of the organ. So here we have a normal liver echo texture on the left, where you can see this sort of homogeneous mixture of bright dots of blood vessel, of the fibrous tissue around blood vessels, in a darker sea of parenchyma. And then on the right, we have diffuse hepatic steatosis, where we have basically fatty liver. And fat is more similar, it's more echogenic, its echogenicity is more similar to the fibrous surroundings of blood vessels. And so you don't see such a contrast anymore between the blood vessel and the parenchyma of the liver, this fatty parenchyma of the liver. Kind of going in the opposite direction, this is a cirrhotic liver that has shrunk down, become more fibrotic. You can see, if you picture all these sort of fibrous septations that run through the parenchyma of the liver, it almost looks as if they've sort of all shriveled together, like the parenchyma. You've started to lose parenchyma and just have these fibrous septations left. And so it's more shrunken down. And you also see some ascites here, so you've got a little extra something where something shouldn't be. You can also look at the size of the organ. So on the left we have a normal sized liver, so you just get a sense for what's sort of the normal ratio of the size of liver versus kidney. And on the right we can see someone with hepatitis, and we have a few things that we can discern about their liver in this hepatitis setting. So the first is that it's large. And then next we can see that the gallbladder, the wall of the gallbladder is significantly thickened. And we can also appreciate some pericholecystic fluid. And so these are classic features of acute hepatitis as seen by ultrasound. Now here's another example of something that doesn't belong. That nice sort of uniform texture of the liver is disrupted by something here. This is a 78-year-old male who had fevers, rigors, sweats, but they couldn't find any infectious focus. But he did have this generalized abdominal pain, so they just had a look. You know, if you got someone with abdominal pain, just put a probe on it, have a look inside and see what's going on. And that's what they find. So this person has a liver abscess. Once again, something where it doesn't belong. This is a 75-year-old male who has right upper quadrant pain, and he'd been vomiting for a day. They took a look in that right upper quadrant, specifically at the gallbladder, and they see a gallbladder that's full of sludge and stones. So normally the gallbladder should have should be filled with an anechoic fluid, or a dark fluid, which you see some of that up towards the top right of the gallbladder. But the most of the gallbladder there is filled with this sludge. You can also see there's some thickening of the wall of the gallbladder, which can occur when the gallbladder is inflamed. This is a kidney. Kidneys are very distinctive. You'll get to know how they look. And in this case, you can see that the fluid in the renal calyces there's too much of it there. It's sort of blown up, and you don't see the sort of horns of the renal calyces as much. Now it's just sort of like blunted and large. And so this is someone who was having backaches. They have a history of having a double J stent insertion on their left side, but now this is on the right side, and we're seeing that they have a renal stone that's obstructing the flow of urine, and so it's backing up, and so we can see that the kidney has hydronephrosis.